Alcohol and drug use while driving, impaired driving, Part 3. Many people mistakenly believe that consuming alcohol while taking over-the-counter pharmaceuticals is harmless, despite the apparent risks of combining alcohol with illegal substances or prescriptions available only by prescription. After all, these medications are easily accessible and can be acquired without a doctor's prescription. Drugs, even those sold over-the-counter, are still drugs. When alcohol is added, they cause a chemical reaction in the body that can be quite harmful. Numerous over-the-counter drugs can cause organ damage, excessive sleepiness, increased alcohol intoxication, heart issues, and a number of other adverse effects when consumed with alcohol. Many common OTC medications become completely ineffective when alcohol is present in your bloodstream, even when the interaction is not very hazardous. Drug anti-inflammatories that are not steroidal and alcohols, NSAIDs. Alcohol does not interact well with over-the-counter anti-inflammatory pain relievers such as acetaminophen, aspirin, and ibuprofen. When used alone, these medications already have the potential to result in digestive problems like stomach pains, ulcers, liver damage, and damage to the stomach lining. When the medications are taken with alcohol, these negative side effects are more likely to happen. Additionally, when alcohol is already in the system and taxing the liver, the danger of overdose on NSAIDs is significantly higher. Medications for allergy, cold, and flu. OTC antihistamines like Benadryl, Zyrtec, and Claritin are frequently used to treat the symptoms of dust, pet, and pollen allergies. Numerous of the active chemicals in these drugs are also found in over-the-counter cold and flu remedies. Unfortunately, very few people consider the fact that taking these drugs with alcohol can be quite dangerous. Similar to alcohol, the majority of antihistamines are modest central nervous system depressants. As a result, drinking while taking an allergy medicine can have a significant depressive effect on the body, which may include extreme sleepiness, which makes driving more risky, dizziness, consciousness loss, dehydration, especially in older persons, liver damage, loss of memory, dementia risk is higher. Background drug and cough medicine. Since many over-the-counter cough syrups already include alcohol, mixing alcohol with them is never a good idea. Drinking while using a cough suppressant will probably cause extreme drunkenness. The active, cough-suppressing component dextromethorphan, which also happens to be a potent hallucinogen, is the basis for the majority of over-the-counter cough syrups. Cough syrup doesn't contain enough dextromethorphan in one dose to make you drunk or give you hallucinations, but alcohol makes the medicine work better. You may develop visual hallucinations, confusion, excessive drunkenness, and sleepiness if you drink alcohol while taking cough treatment. Never combine the two ingredients. Driving ability, over-the-counter drugs, and alcohols. The majority of OTC drugs interact with alcohol in a big enough way to affect your ability to drive. Keep in mind that any mental or physical impairment, no matter how slight, will make it harder for you to control your car and react to changes in the road in a timely and effective way. Driving while intoxicated and taking over-the-counter medications can result in overall slower reaction time, inability to concentrate while driving, driving while fatigued or passing out at the wheel, decision-making and visual information processing challenges, poor speed control and sloppy maneuvering. As a driver, you are legally obligated to ensure you are mentally and physically fit to drive every time you get behind the wheel. Always read the label of any OTC medication you are taking and monitor yourself closely for any undesirable side effects which may render you unsafe to drive. Under no circumstance should you drink alcohol while using any OTC drug or prescription medication, especially if you intend to drive. You may believe that you are under the legal BAC limit and feeling perfectly fine, but keep in mind that the presence of other drugs in your system may increase your alcohol absorption rate or prevent your liver from eliminating alcohol effectively. The effects of different drug combinations. Using any combination of illegal drugs, prescription drugs or over-the-counter drugs will produce an array of unpredictable and often dangerous results. Taking multiple drugs at the same time is known as polydrug use. People who engage in polydrug abuse often do so for recreational or self-medication purposes. While different types of drugs interact with each other differently, combining any two drugs is likely to heighten the harmful effects of both substances. Let's look at the risks associated with some common drug combinations. Heroin and cocaine. Combining heroin with cocaine is a dangerous recreational practice known as speedballing. As heroin is a depressant and cocaine is a stimulant, users believe they can mix the substance to balance their experience. Speedballing carries an enormous risk of overdose and death, as cocaine puts a strain on the heart while heroin slows down respiration. As heroin's effects generally last longer than cocaine's, the user may be overcome by the heroin when the cocaine wears off. Taking heroin and cocaine, or any other powerful stimulant, together often leads users to feel less intoxicated than they truly are. As a result, they may believe that they are capable of driving safely. Getting behind the wheel while under the influence of heroin and cocaine would be incredibly stupid. You may feel relatively sober to begin with, but as soon as the cocaine begins to wear off, the depressant effect of the heroin will take over and you will suddenly become extremely impaired.